something that's really, really important that we as Black folks don't often talk about is our family history. So I would say, over the past 10, 15 years, we've been getting DNA tests and it's like, oh, I'm this percent of this and I'm this much and whatever. But one of the things that really is kind of right under our noses is just to ask family members, like, do you think anybody was depressed in our family? Did anyone ever happen to go to a psychiatric hospital for any reason? And even if they're not able to give you clear diagnoses, when I see patients, a lot of my patients aren't really able to, may not have access to the information, but sometimes they do. And sometimes them saying, oh, well, my mom said that her sister or my aunt was hearing voices or schizophrenic. It can really be helpful. I think that what we really need to do as far as ourselves as Black people and Black women is to, really get the information together, in my family, there's one particular person who kind of keeps all of our mental health and medical issues together. But I think we all should be doing that because it really, really can be helpful. So here's an example. I remember being in residency and being told that, well, if you have a patient who is depressed and you find out their sister might have depression as well and is taking a certain kind of medication, there's a chance that that same medication may actually help your patient. Now, does it mean like, oh God, if I don't know that, I can't, prescribe medication or help the person? No, but I think that the more we're armed with information, that makes it easier for us to talk to a mental health professional. And it also makes it a lot easier for us to be our own advocates. And then when it comes to how someone would seek help for themselves or their family, I've really been directing people to the website that you mentioned, therapyforblackgirls.com. There's also a similar website called therapyforblackmen.org. And although as mental health professionals, Black folks really, we don't represent even up to 10% of all therapists or even like less than 5%, I would say, of psychiatrists. I know it's hard to find some that looks like you. I know sometimes I remember talking to someone recently who is a Black woman and she has a white mental health therapist. And for her, it's fine. Like, she's like, hey, like, I can connect with this person. I feel like this person can understand me and is empathetic to my situation. But I would say, for me, when I have been in therapy, I want to see a Black woman. I don't want to have to take time out and describe certain terms. Like if I said something about like, oh, like, well, so-and-so's kitchen, I'm not talking about where you eat at or where you make food. Right. Like I'm like, look, if time is money, I want to make sure that my time and money is being served in the best way for me. So have I seen white therapists before? Yes, I have. But I would say that for me personally, I tend to connect better with Black female therapists.